So let's talk a little bit about the Mexican medical market. It's a very, very interesting medical market. First of all, basic economics. 130 million people, GDP of about $1 trillion. Per capita, that works out to about $8K, which is a solid buying position for most places. We have 5,000 hospitals on paper, with about 2 doctors and 2 nurses per 1,000 people. It's a little bit of an unusual number to understand, because what really happens is we have about 3,000 little tiny hospitals, less than 50 beds, no surgery, no inpatient facilities, but they call them hospitals. About 1,000 hospitals are very, very high quality private hospitals, and these belong to 5 hospital groups that really run the really nice hospitals. Then you have about 1,000 government hospitals that are divided up into different groups. Okay, so now the payment system comes in. Only about 10% of Mexicans have health insurance that's private health insurance. About half are covered by Social Security, which is sort of a combination of an employer contribution, the family contribution, and government contribution. And then about 13% are government employees, and they have their own type of Social Security system, their own insurance. So those are the insurance groups that are going to pay for health insurance. But about 50% of services are provided, paid for privately. Very often somebody will walk in and just pay for services, but it's really a distorted mix with very high end and very low end, because the low end people, some of them are paying cash, but they're walking in and they're having minor surgery or they're having dialysis or something like that, and they're just paying cash for it. In terms of causes of disease, okay, violent death is number 4 in Mexico. Traffic accidents are number 10. Everything else in the top 10 are lifestyle related. So Mexico has a huge problem with lifestyle-driven diseases, diabetes, cardiac, smoking-related, pulmonary, etc. And these are the things that people are trying to deal with, and they fall unfairly or disproportionately among the poor people as opposed to the rich people. So the poorer you are, the more likely it is that you're going to have diabetes, end up at the state hospitals or the Social Security hospitals. There's a huge gray economy in Mexico, and that gray economy also drives the fact that a lot of people don't have medical insurance. Some of the hospitals are the most beautiful hospitals I've ever seen. Even the low-end hospitals, the poor hospitals, years before Americans were thinking about how important it was to have good views and airy rooms and allow for visitors, Mexican hospitals were setting up giant open windows, curved walls, and couch areas so that families could come. Because your typical patient here is going to have multiple overnight visitors. People aren't going to trust the hospital staff to take care of their families. They're going to want people to hang out. The family is going to hang out with the patient. All in all, it's a very good market. Vast majority of everything they buy is imported. America's an important trading partner. What you will see, though, is the last few years they've had a lot of economic problems. Some of it caused by politics with the United States, and some of it caused by the drop in oil prices. The drop in oil prices really hurt the Mexican economy, and it's slowly coming back up. Remember, when you're ready to grow your international sales, reach out to us. We can help.
When you decide it's time to grow your international sales, call us.